Did you know that lung cancer is the leading cause of cancer-related deaths in the United States? Well, today we're talking about cancer screenings, in particular lung cancer screenings. Dr. Sami Jawad joins us this afternoon from the Clinch Medical Center. Doctor, thank you so much for coming in and talking with us.
Thank you.
And let's begin before we get to the screenings. Let's talk about who is at risk and a little bit about lung cancer and folks, what they need to be watching out for.
Sure. Well, lung cancer being the leading cause of death in both female and males in the United States, and it's being the second most common cancer in both males and females, it's very important to early recognition and treatment of the lung cancer. And anyone who smokes is at increased risk of having lung cancer, as 85% of lung cancer patients is actually a smoker or a former smokers.
But you don't have to be a smoker or a former smoker to develop lung cancer. So someone that's out there thinking, I've never smoked a day in my life, they could still be at risk.
Unfortunately, that's true. 15% of people who have lung cancer never smoked before.
Let's talk about screening. How do we, lungs are deep inside here, we can't see that. How do we screen for this and watch out for it?
Well, for many years, unfortunately, we didn't have anything to look or to find about lung cancer or to detect it early. And the unfortunate part also that lung cancer sometimes can present in advanced stage with no symptoms at all. And that's why just recently we found that doing a CAT scan in a certain population of people can help us to detect lung cancer early on and therefore treating it hopefully successfully.
And you guys are doing the CAT scans now, and what goes into that for a patient that's coming in to be screened? Is this a very invasive procedure? Some folks may want to try to shy away from it.
Sure. To put it in a simple way, it only takes a simple image. We call it a CAT scan. It takes about 1 to 2 minutes. The patient will be exposed to a low dose or low amount of radiation for a few seconds. It's totally, the patient will not feel anything. And for those patients who qualify or will benefit from the screening, it's recommended to be done yearly.
And talk about, is lung cancer one that we can detect early? Is it something that if we catch it early, might maybe improve our chances?
Definitely. Lung cancer, to put it in a simple way, divided into 4 stages. The simplest stage is stage 1, and this is what we're looking for. We're looking to find those patients in stage 1, as those patients will benefit from surgical removal of the tumor without even need to get any further treatment, whether it's chemotherapy or radiotherapy. In contrast, stage 4, which is the advanced stage of the disease, unfortunately, there's a little can be done for those patients. So we always try with lung cancer screening, and that's proved to benefit the patient from detection the cancer early and treating it early. And to put it a simple way, lung cancer screening is comparable to mammogram, and it's almost as good as mammogram to detect breast cancer.
Dr. Jawad, thank you so much for coming in and talking with us today. Some great information. Of course, we have more information about lung cancer screenings and Clinch Valley Medical Center and how you could take advantage of the screening on our website. It's at WCYB.com. It's a great afternoon out there.